Present topic of discussion is intermuscular spaces around the scapula and their clinical relevance. Intermuscular spaces around the scapula are the potential spaces among different anatomical structures, and these spaces lie between scapula and the upper part of humerus. These spaces are formed by upper part of humerus, long head of triceps, teres minor and subscapularis, and teres major muscles. They act as passageway for neurovascular structures. Knowledge of these spaces and the structure which pass through these spaces is necessary during surgery in the shoulder region. There are three intermuscular spaces around the scapula. These are number 1 quadrangular space, number 2 upper triangular space, and number 3 lower triangular space. First, the quadrangular space. It is bounded superiorly by number 1 lower border of subscapularis in front, number 2 lower border of teres minor behind, with the capsule of the shoulder joint lying in between these two muscles. Inferiorly, it is bounded by upper border of teres major. Medially lie the lateral border of long head of triceps, and laterally lie the surgical neck of the humerus. As regard the contents, axillary nerve and posterior circumflex humeral vessels pass anterior to posterior through this space and supply the deltoid muscle. Second space is upper triangular space. It is bounded superiorly by lower border of teres minor posteriorly and lower border of subscapularis anteriorly. Laterally, this space is bounded by medial border of long head of triceps, and inferiorly lie the upper border of teres major muscle. As regard the contents of this triangular space, circumflex scapular vessels travel through this space and approach the infraspinatus fossa. Circumflex scapular artery pass through this space and join anastomosis around the scapula. Third space is lower triangular space. It is bounded medially by lateral border of long head of triceps. Laterally, it is bounded by medial border of humerus, and superiorly, it is bounded by lower border of teres major muscles. As regard the contents, radial nerve and profunda brachii vessels pass through this space to enter the posterior compartment of the arm. Dislocation of the shoulder joint and or fracture of the surgical neck of the humerus may lead to damage to the axillary nerve. If this happens, this leads to motor as well as sensory loss. As regard the motor loss, deltoid is paralyzed, which causes loss of the rounded contour of the shoulder, and greater tubercle becomes prominent. In addition, power of abduction between 15 to 90 degree is lost. As regard the sensory loss, it occurs over the lower half of the deltoid in a badge-like area, which is referred as regimental badge area.